Hello and welcome to this interview session with Dr. Felicity Savage, who is the chairperson of WABA, the World Alliance for Breastfeeding Action. My name is Amal Omar Salim, and I'm the executive director of WABA. I'm a nutritionist and I have a PhD from Uppsala University in Sweden. My main areas of interest and expertise are nutrition, breastfeeding, of course, international health, gender, program planning, research and advocacy, with a special focus on Africa and Asia. So today, I would like to welcome Dr. Felicity. Felicity, would you like to tell us a little bit about yourself?
Hello, thank you so much. It's very nice to be here. Yes, I started life as a pediatrician and became very interested in community child health, working in a number of different countries in Africa and in Indonesia. And then became particularly interested in breastfeeding round about the time of the Baby Friendly Hospital Initiative. And then I became involved in training health workers in breastfeeding counselling, and also at a more advanced level for resource people, master's level training in both London at the Institute of Child Health and in Malaysia with WABA.
Okay. Yes, so this year, World Breastfeeding Week 2020 focuses on, the theme is actually support breastfeeding for a healthier planet. And it highlights some of the links between breastfeeding and the environment and the climate, and the importance to protect, promote, and support breastfeeding for the health of the planet and its people. And this year we are trying to get together, bring together many organizations, both those that are involved in breastfeeding, but also those that are involved in environment and climate change issues. And so I would like to ask you a little bit about when we talk about support for breastfeeding, what is skilled breastfeeding support and why is it important?
Yes, we are talking quite a lot about skilled breastfeeding support at the moment, but we also, what that means also is breastfeeding counselling, which perhaps is a little bit more precise term because breastfeeding counselling uses counselling skills to talk to mothers in particular ways. Breastfeeding counselling or skilled breastfeeding support, it means talking to the mother, listening to the mother, learning what she's feeling, what her ideas are, and building her confidence, but also giving her a very skilled support in helping to get the baby established on the breast and also to help her to overcome problems. So it is a combination of both the ways in which you talk to a mother to help her to find her own way of doing things, to decide what it is that she really wants to do, but also giving her the skilled help to enable her to do that. And it's a very special skill, really, breastfeeding counselling.
Yes, so if it's a very special skill, so who should be involved in providing breastfeeding counselling then?
What is really important is that people are trained to do it and that they have the right competencies, both in their communication skills and in their practical skills. It can be health professionals at all different levels, from pediatricians or obstetricians, or particularly midwives are particularly important. But there may not be enough of them to give mothers enough help. And people who are extremely important are lay mothers from the community who learn how to provide breastfeeding counselling and develop the right competencies for that. They can be trained, and they do often, well, certainly as good a job as the professionals, that they that sometimes they do an even better job in the basic help for mothers, but they need to work with health professionals as well for when some of the mothers' problems get a little bit more complicated and difficult. They need to be able to refer to health professionals who've also been trained, and of course lactation consultants whenever they're available. There may not be many of them in the communities, and to have a breastfeeding counsellor nearby in the community is perhaps the best way for this to be provided to mothers. But lactation consultants are excellent and particularly good if there are difficult problems.
Yes, so we're talking about a range of people who can provide, but they need to be trained.
Yes, and they need to be trained. They need to have consistent skills and messages to give to mothers. They all need to be giving the same messages. That's the most important thing.
Yes. So what would you say needs to change or to improve when we talk about providing skilled breastfeeding counseling?
We need to make sure that there are enough people who are given the time to do the work. And that's why it's often particularly helpful to have lay women from the community who can give mothers more time. But it is also very important that they are supervised, that they are trained, and that they are supervised by more experienced people, such as health workers, perhaps midwives, community midwives, health visitors, who are also themselves trained. They won't necessarily have the skills unless they're specifically trained to have them, to supervise the mothers and to make sure that they know what they're doing, that they are able to use the competencies that they've been given, that they understand what they have to do, and to, as well as doing the sort of administrative side of supervision and seeing how many times they've seen mothers, how many mothers they're seeing, if they're seeing them often enough, and whether they are able to do what they're supposed to do. They also need to give the mothers, give the breastfeeding counsellors a little mentoring, go on teaching them the skills and helping them when they have a problem to see how they could help it, and if it happens again, then they could help another mother in that way, working alongside them and going on teaching them. It's very difficult in a training course to give the breastfeeding counsellors enough practice to learn all the competencies that they need to develop fully. And so to have ongoing, in their supervision, ongoing help to learn those competencies and to become confident in them is very important.
So it's also about building confidence in the breastfeeding counselors themselves.
Absolutely. Building confidence, yes. And having the chain of the cascade of training from senior people at central level down to the supervisors of the counsellors and the counsellors themselves.
Yes, thank you. So when we are looking towards guidelines, materials, and so on, countries may want to implement skilled breastfeeding counseling. What types of materials are available at the moment?
Well, I'm happy to say that they would probably get a lot of support and help from UNICEF and WHO and from a number of other organizations in collaboration with WHO and UNICEF. We have been developing various materials. WHO last year, a couple of years ago, they produced guidelines on breastfeeding counseling and the reasons, the evidence why this is so important and what actually it involves. And currently they are also developing guidance about how to implement the program. And there are a number of training materials that have been available for some time, produced by WHO and UNICEF and other organizations, that can be obtained on the internet, particularly through the WHO and UNICEF websites. And these are currently being updated alongside the guidelines, and they should be available fairly soon. And there's also a lot of resources available for the Baby Friendly Hospital Initiative, which is also important in having breastfeeding counselling.
Yes, and so we have those guidelines, the Baby Friendly Hospital 2018 guidelines to lean upon until
Yes.
the counselling guidelines come out.
Those are specific guidelines on what we mean by breastfeeding counselling and what the evidence for it is. Yeah. So there are guidelines already available for breastfeeding counselling.
That's good. So we can look forward to breastfeeding counselling guidelines in the near future.
Yes, the guidance, it's difficult. The words are so similar. It's
Yes.
difficult to, the guidance is more practical and the guidelines is more theoretical.
Okay, yes, good. Thank you for that distinction. So let's move on and talk a little bit about challenges and some solutions. Breastfeeding counseling in normal situations and also in crisis situations, such as the ongoing global pandemic, the COVID-19 pandemic. Could you say a little bit about some of the challenges and solutions in a normal situation?
Yes, I do think it's important to think of them first before we think of a crisis, because in a crisis you will need all the challenges that you have in an ordinary situation. So we need to get the basics of breastfeeding counselling thought through first. And what is important is to ensure that mothers are taught during pregnancy, that they learn about breastfeeding, about how important it is, but also what will happen at the time of delivery, soon after delivery, and what they need to do, what they will need to do to get the baby breastfeeding. And if they are prepared during pregnancy, they're more likely to succeed. And then they need the help, which is provided, a lot of it through the Baby Friendly Hospital Initiative, about the baby being put in skin-to-skin contact with the mother immediately after delivery and not having any other kind of feed other than breast, really, unless it's medically necessary. Then they should only have breastfeeding from that time, and the baby allowed to attach to the breast, and with the necessary guidance and help to help the baby in the first few days to attach to the breast in a way which is going to be effective for breastfeeding, and to make sure that the mother knows how to do that and that the baby is able to do it, and then to have support doing that for the next several days and the first couple of weeks, particularly. If the baby is established in suckling during the first couple of weeks, then they're going to have a much easier time subsequently. They're going to be able to continue breastfeeding more easily. If they don't get that help in the early days, then it's going to be more difficult, and if they have problems, then it's going to be more difficult to overcome them. Of course, it can be done, but it requires much more skilled help. So it's getting things right for all mothers in the early days, which is critical. And then as the baby gets older, problems will arise from time to time. The mother wonders if she's got enough milk, or she thinks that the baby is crying too much, or things are not going quite right. And so she needs somebody who can reassure her and build her confidence again and listen to what she's worried about. And then, of course, later on, when a mother's thinking of returning to work, or even quite early, but as soon as she starts worrying about going back to work, which in some places it happens in only a few weeks after delivery, to help her to find ways so that she can continue breastfeeding when she returns to work. There are different ways in which this can be sorted out, but an important way is often to help her to be able to express her milk and to leave that for the baby and to store it so that when she goes to work, somebody else is able to give the baby the milk. Or, of course, if the baby can come with her to work, that's wonderful. Or if she can go home and feed the baby, that's wonderful. But you have to work out for each mother what is going to be suitable for her. And that is a big challenge. I think that one of the major problems that women don't manage to continue breastfeeding, a very common one, is that they have to go back to work and they don't know how to handle that situation. But then, as you say, of course, there are the crisis situations. There are emergency situations all the time, all over the world. But now we particularly, and mothers need help from breastfeeding counselling in those emergency situations in order that the baby's not going to end up, well, often dying because of they're not fed sufficiently. But in general, the kind of help they need will be similar to that, but the difficult thing is actually getting it to them. But now we have the problem of COVID infections, and that is becoming a new problem. And in a lot of places, people are so worried that the baby might get COVID from its mother that they are separating the mother and baby at birth. And we now need to make sure that people understand this is not necessary, that mothers can continue breastfeeding, that COVID infection is not transmitted through the breast milk. And if mothers take hygienic precautions and wear a mask and wash their hands, then they can continue breastfeeding and in the normal way, and that babies on the whole are not getting ill from COVID very much. Occasional babies get a little bit ill, but they recover pretty well. Yes. So this is something to make sure that people aren't, out of their anxiety, stopping breastfeeding unnecessarily and separating the mother and baby. Very difficult to just make people confident that that's all right.
Yes, and WHO and UNICEF and several other international agencies do have guidelines on this. And I think that's important to emphasize that we should follow those guidelines.
Yes, absolutely.
And not be worried about breastfeeding in the context of COVID-19. You did talk a little bit about earlier about counseling, and I was just thinking, what is it? What are some of the building blocks of breastfeeding counseling? How is it different from support in general?
Counselling requires specific skills. Yes, support can be sort of being nice and helpful and kind to a mother, and that can be very important, or merely just agreeing and just saying that, it's wonderful that she's breastfeeding and can you help? But there are some slightly more complicated things. How to listen to a mother requires a certain amount of skill and training to understand what you really mean by listening to the mother. It's very easy to keep saying to a mother, oh, don't worry, or yes, I know all about that. And this doesn't actually help the mother. You have to learn how to listen and let her talk, and how to respond in a way which encourages her to go on talking. Mothers often have quite deep worries that they find it difficult to talk about. For example, they might have had a difficult relationship, an argument with somebody who is making them worried, or that a relative is somehow discouraging them, and they need to be able to talk about that and think how they can deal with those kind of problems. It's not necessarily... So listening to a mother and then knowing how to respond can be extremely helpful, and it can make an awful lot of difference to how much you help that mother. People who've learnt how to listen to a mother realize the mother will tell them an awful lot more straight away about what their real problems are, and that makes the mother feel better and feel more able to continue. Then building her confidence is another skill, that you need to have good communication skills to build her confidence as well. And making her feel that what she's doing is right, and not letting her feel that it's her fault that she's done things, and giving her information, not telling her what to do. You should do this and the baby won't get the milk if you do that, but knowing how to put it in a way which doesn't make her feel that she has been put down by what you say, or that she's done something wrong and then she feels bad. You want to make her feel, no, she's doing fine, but maybe the baby needs a little help to do this.
Yeah, so it is really quite different from giving advice.
Absolutely, it is. Yes, it is. Thank you for mentioning that. It is absolutely different from giving advice. And people often think that they should be counselling mothers to do something, which is not what we're meaning. That sounds like giving them advice. You must feed the baby in this way. No, it needs to be in a subtler way, not giving advice.
Yeah, so it is really about seeing each individual mother and baby,
yes.
and to extract what they know and let them express themselves and find out. And very often you would probably find that they have the solutions themselves and just need to strengthen that.
Yes, or they will come to a sensible conclusion themselves about what needs to be done.
Mm-hmm.
And they won't try to think they have to do it in order to please you, the health worker.
Yes, and I think that another aspect of a crisis situation such as this COVID-19 is that many mothers, parents, families are under a lot of stress, and stress does, of course, affect breastfeeding. So listening to the mother and letting her vent her worries and so on will also help to reduce that stress.
Yes, absolutely. Her mother or her mother-in-law may be trying to tell her what to do, or say that, or maybe she doesn't have enough milk, she should give the baby something else as well. That's why the baby's crying too often. And this can cause a lot of stress and make her feel that she's not doing it right. And so she needs to be able to talk these things through, but she also needs to feel free to say that she has these worries and that she has these problems, or not to be, that it isn't a bad thing to talk about them.
Yes. And so does that, what do you think about involving other family members, fathers, partners, grandmothers in breastfeeding counselling support?
I think it's absolutely critical that they are involved. And although it's also important to talk to the mother by herself sometimes so that she can talk about any difficulties, but you also do want to bring the father, often a critical person in giving the mother that kind of support which helps her to breastfeed, and her mother or whoever is near her mother, her mother-in-law, her sisters maybe, anybody in the family who is an important source of support for her, to talk to them also and to make them feel that how they should be giving that support, and to teaching the fathers how to help the mother position and attach the baby at the breast can be very, very helpful. They get very expert.
Yes, and they like to feel involved as well.
Yes, and then they feel that they are having a real role to play in the fathering of the child too. They're not sort of being kept out by the mother saying, "Oh, this is my thing, I've got to do it," and then they feel left out or pushed out.
Yes, and so breastfeeding does concern all, and we have to be mindful of that too, and address those issues. So just to wrap up, what we would like to have some key messages from you, and I'm thinking of what would be your key message to policy or decision makers?
I think we need to get them to see that this is something important that they do have responsibility for, and that they can achieve a great deal in the health of their population if they can get mothers breastfeeding satisfactorily. And in order to do this, they need to be prepared to invest money in training health workers at different levels. They need to get, they need to have expert people at the top of the system. People, somebody, one or two, depends how many they can afford, but people who have expertise to help organize the system. And to train it, then there needs to be training introduced at different levels for senior managers and advisors, and training of trainers, training of people at different levels to set up the system with good leaders at the top. And they need different kinds of training. Also, in the medical school and the midwifery school and the nursing schools, breastfeeding counselling needs to be introduced so that everybody is aware of this important thing that's going on. But some people, they may not get enough to be really expert in their basic training. So some people will need to specialize in this. Somewhere we need to have some professors of breastfeeding, and I think they are beginning to be one or two here and there. So you need to have, but the policymakers need to set a system to make sure that there are enough people down through the ranks to make sure that in the healthcare system and in the community there are enough people to be able to provide help to every mother. And that's a challenge, but it is what I think people should be being aware of and aiming for.
Yes, we need to aim for that. And so what would be your key message to the healthcare system and the community?
The healthcare system needs to, well, one thing is they need to work together and have consistent messages and consistent ways of practice and competencies that go through the system to help the mother. They need to be doing the same thing or being aware what the other person has to do. And they should be responsible for providing a minimum of 6 contacts for mothers. Often mothers may require more contacts than that, but at least you start with a minimum of that number of contacts, scheduled contacts provided to all mothers. It's not just enough to make this available for the mothers to come and get if they want to. Mothers often won't have the confidence or the understanding to come and get the help. They need to be given that basic level of help as a statutory thing to happen to them. And some of this obviously can be in the communities if the lay breastfeeding counsellors in the communities have been trained, that the midwife can see the mother for the first 1 or 2 times and then pass them down to the community health, to the community breastfeeding counsellors. And that's the responsibility for the healthcare system at different, possibly a key point in the system might be the provincial and the district healthcare system. There should be somebody there who is responsible for making this happen, and that there are enough people able to give mothers the help that they need.
Yes, so basically they're creating like a warm chain of support and across the healthcare system and the community, and also somebody to coordinate this support.
Absolutely. And it's bound to be different people at different stages for the mother. For example, she may see a different person antenatally, and then at the time of delivery, and then soon after delivery, and then later on. There will be some of that will happen under the hospital. Some will happen in the community health facilities. Others may happen in the community. But if they're working as a team and they're passing, that the mother is going along, and then she knows that she's going to get the same messages from all of them, or she can be referred back to a higher level if necessary, then that will make the whole system work. And that is the warm chain. It is this chain of support and help for the mother, going from antenatally, even before perhaps, but certainly from antenatally through until the child is 2 years.
Yes, so that will hopefully get the breastfeeding rates improved if we can create and implement this warm chain. And finally, what would be your... Sorry, go ahead.
I'm going to say, I mean, this is the best way to increase breastfeeding rates, to make sure that mothers have breastfeeding counselling contacts scheduled at certain times, and that is the most effective way to increase breastfeeding rates.
Yes. And so finally then, what would be your key message to parents, families breastfeeding who want to breastfeed?
I wouldn't only choose the ones who want to breastfeed. I would want to choose all mothers to understand the value of breastfeeding, and hopefully to find their own way to wanting to do it. But we would also want mothers to do what they can themselves to find out about breastfeeding, to take an interest, maybe to talk to their friends or look it up, talk to other people about breastfeeding, but also perhaps if they use the internet, they can look up on the internet. There's so much material there, and talk to their midwife particularly to make sure that their midwife can give them the help that they need and will give them the help that they need. And also for the mother and the family and the father to get them all interested, and the grandmothers and the grandfathers too, and cousins and aunts and everybody else, but to get them to understand the mother's goals, what she wants to do, and to learn where the help can be obtained, where she can get the help, to understand that she should be, hopefully, it won't all happen in the next fortnight, but where she will be given help, and where she can get help if she feels that she needs more than is provided. So she needs to feel that she can take control of what she's going to do, and that she can not wait for something to happen, but that she is in control of getting help, and not that she's responsible entirely for that. She needs to be given the help, but she also needs to feel that she is responsible for bringing it all together.
Yes. And I think that you've put it very nicely, that the policy and decision makers are responsible, and the healthcare systems have to provide, and mothers, parents, and families need to find out, and also not only about the benefits of breastfeeding, but also to set their goals and find out where they can get the help that they may need along the journey. So thank you very much, Felix, for sharing your expertise and experiences about breastfeeding counseling. And now we are in the middle of World Breastfeeding Week. So we would like to wish everybody happy World Breastfeeding Week 2020. Support breastfeeding for a healthier planet. We will get benefits and win-win for both the planet and its people. If you would like to know more about this year's World Breastfeeding Week, do visit www.worldbreastfeedingweek.org, which is the dedicated website, and there you can download materials, assets, join us on the social media, and take care. Thank you very much.
Thank you. Bye.
Bye-bye.